Welcome to Let's Talk Aesthetics. If you are looking for a plastic surgeon that had a true heart for serving you, we have an amazing guest for you. We are going to be talking with the plastic surgeon all the way from UK in Pakistan at AASP. So we are talking about Dr. Adil. So let's go and talk to Dr. Adil. Hello everyone, welcome back to Let's Talk Aesthetics. So we have another amazing doctor with us all the way from the UK. We have an amazing plastic surgeon, Dr. Adil Khan. Welcome to the show.
Thank you very much. Very kind of you.
Why don't you tell us a little bit about yourself and your practice? What are you doing?
I'm a consultant in Newcastle at Northumbria.
Okay.
And I have been a consultant now for 2 years, and I mostly do skin oncology, I do aesthetics, I do more surgery. I've done a lot of reconstruction work, but primarily now concentrating on skin oncology.
Okay. And how long have you been in the UK?
I've been there since I finished med school, so It's now been over 20 years.
So I was talking to you earlier. So you mentioned you were in California for some time, and then you moved back to UK.
Yeah, I finished med school, and everybody from Aga Khan usually ends up in the US. So I went to UCLA. I was there for a year, but I kind of liked the whole appeal of the UK.
Tell us more.
So it's you don't have to conform to a tiered insurance system. It's free for the NHS. I mean, surgeons there, while training, they're on a salary. There's and the pathway is longer in terms of training. You do but at the end of it, you get a consultant post where you basically treat patients all equally.
Yeah.
You don't have to make decisions based on finances.
Who can pay? So that is important.
It's important, even though my salary could have been 10 times more in the US. But I think the peace of mind that comes with not having to worry about providing sort of unfair healthcare, I think that's very important.
So it sounds like the service is important for you.
It is. How would you feel if just based on the type of insurance you had, the company denied you some treatments that could give you an advantage in terms of your quality of life?
I would not feel good. Yes.
It was, and especially from a healthcare professional to deny somebody this, knowing that you're denying something. It's just, and people say it's ethics, fair. People say it's morals, but I think it's actually basic human right to have the best healthcare.
You're so right. It is a basic human right, and that is one good thing in UK. Even though the NHS is quite overloaded.
It is, yeah.
So many patients, such a long lines,
But we're doing everything, and the COVID has been both a disaster and a boon because telemedicine, a lot of other things that have come out of COVID, we're able to deliver much better care. More cost effectively, and
absolutely. Even in the USA, I mean, doctors were not that open to telehealth, but the COVID was a time when it just literally flourished, and it just made people aware, patients as well as doctors, that hey, it is okay. Yeah. It makes things a lot simpler, easier for the patients as well as for the practitioners.
Absolutely. Yeah.
So you're here in Pakistan now. So you're training at the AASP, our third annual conference happening. So how has it been for you so far?
Mind-blowing. I mean, meeting you was a perk. Absolutely. Meeting your wonderful husband was amazing.
Thank you.
I did tell you that I have known your company, London Aesthetics UK, for some time now. It's very popular both in England and in Pakistan. And getting to meet people like you, network, and go through the most wonderful, up-to-date lectures and workshops, it's just amazing. I think the kind of work that people have done here, Shaybano and a lot of other faculty, Zia Saab, I think it's amazing for this to be put together in Pakistan, and the kind of good work you're doing in Pakistan with the courses.
Well, we're trying our best.
I know, but it's quite unique because this kind of a path is not really something I've seen before. I've seen people set up like ad hoc courses which come and go or they fizzle out. But to be able to set up a quality assurance exercise and then deliver it repeatedly and reproduce it with good results. And I just found out that your courses are also recognized in the UK.
Yes, they are. They're recognized in the UK as well as many other countries. But it is important, right, for us, for our training as well as clinic, it's important that we provide the best possible trainings to the qualified people. Yeah. It is important to have the right kind of, in order to do any kind of aesthetic procedure in Pakistan, you have to be a doctor. you have to have a license.
Yep.
So otherwise, there's unfortunately in the market, that so many people are training anybody and everybody.
Yeah.
It's not about just a shortcut. It's not about just making a quick buck, right?
Yeah.
Like you made a move from the USA to the UK because it was important for you to make the right choice. It was important for you to provide it, right? So the same way, we are trying to provide the training, but to the right people.
Yeah.
And in the right way. So make sure whatever we are providing, it is done 100% in the right manner, because you are playing with people's lives every day. And you know that as a plastic surgeon.
And as you said, this quality assurance is so much more important now than ever.
Absolutely.
Because there are so many different ways to skin a cat, as they say. And when there is more than one way, it's not the right way,
Yeah.
So to be able to choose and to be able to deliver it to select people, I mean, in the UK now, I know that both organizations to do with plastic surgery, BAPS and BAPRAS, they're trying so hard to try and stop sort of non-qualified people from delivering, especially non-surgical aesthetics, right?
Yeah.
And you won't believe, my nurses have had things done on the cheap, which by beauticians, by non-qualified people, and they've had disasters. The problem is the court system in the UK cannot handle these kind of cases, especially problems with Botox and fillers, because by the time the court case develops, it's usually been about 2 to 3 years.
Right.
So the filler is either dissolved or whatever, and that's why. So it defeats the whole purpose, because you can't do anything.
It is like a hole in the system right now. It just
yes, but the fact that in a place like Pakistan, where sometimes people have the opinion that anything goes, you're still adhering to the quality, and that's
Absolutely.
And I mentioned to you that my friend Ahmed Haq also has mentioned this and highly recommended these.
I will really appreciate that. We really do appreciate it. I mean, just look at you. I mean, right now you are a plastic surgeon, and you are still trying to train yourself even more and more in aesthetics and otherwise. So this is a great example for anybody else, any new doctor or otherwise, to continue to learn.
Yeah,
it's always staying
absolutely.
open to learning and adding on more to your toolbox.
So a lot of the stuff that we've seen today, in the workshops and yesterday, I've been doing it, but looking at, for example, Dr. Shahrbana do it, Alicia do it, Dr. Aziz do it, you see how it can be done differently and
ways.
Sometimes in much better ways. I have really learned how to improve my technique in a number of things. So, it is always a learning exercise, and that's what everything's about in life, isn't it?
Well, we really appreciate it. You have been a great example and great inspiration for everyone, including myself and many more, to make sure that we continue to learn, we continue to hone in our skills, learn from our colleagues, and of course our patients. Every time a new patient comes in, you learn something new.
Yeah, absolutely. And it's been a very nice experience for me to meet you and your husband, because you being Pakistani and him being such an entrepreneur, the way you've joined forces and what you're doing for the country and just basically for the name of the place is amazing.
Well, thank you so much.
Thank you so much.
And thank you for your time, and thank you for
My pleasure.
being here.
Absolute
with us.
pleasure. Thank you.